Have you ever wondered if we are grooming future doctors to burnout before they even start training? Today's conversation dives into how perfectionism may take root before high school and how medical education plays a role and what we can do about it. Welcome to Success Reimagined. I am Dr. Amna Shabbir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well being. I am so glad you've joined me. Let's reimagine what's possible together. This episode contains discussion of suicide. Please take care while listening. If you or someone you know is struggling, call or text 988 for confidential support. Welcome back, and today I have a very special guest with me, Dr. Stuart Slavin. Dr. Slavin is a pediatrician, medical educator, and a leading advocate for physician well-being. He currently serves as the vice president for the well-being at the Accreditation Council for Graduate Medical Education, or commonly known as ACGME, where he works to improve the mental health and resilience of residents, fellows, faculty, and medical staff nationwide. His career has spanned over 2 decades in medical education, and his research has explored the impact of maladaptive perfectionism, imposterism, and cognitive distortions on medical trainees, shedding light on how these tendencies contribute to burnout and poor mental health. He has also co-authored work on helping trainees balance performance and perfectionism. Dr. Slavin was prominently featured in the documentary Do No Harm, which exposes the hidden epidemic of physician suicide and burnout. Today, he continues to lead national efforts to reshape the culture of medicine and support well-being of the next generation of physicians. Welcome, Dr. Slavin.
Thank you so much, Amna. Just a great pleasure to be here with you. Thank you.
Absolutely. I'm going to jump right in, and I'm going to ask you what inspired you to dedicate your career to promoting well-being in healthcare, particularly with this rigorous emphasis that you have on medical education and residency training.
Yeah, it's kind of an interesting story and one that was honestly very unexpected. So, as you said, I'm a pediatrician by training, and early in my career, I got a master's degree in education, and a good large chunk of my career, it really focused on medical education, initially as a pediatric residency director, pediatric clerkship director, medical student teacher and course director when I was at UCLA. And then I went to St. Louis University as associate dean for curriculum. And it's there that I developed this interest in well-being kind of completely out of the blue in some ways. And basically it was early, gosh, I guess about 2007, 2008, a few years after I'd arrived at St. Louis University, I started reading information about medical student depression and anxiety. And we ended up doing something really important, which was we measured those outcomes in our students and saw that we were seeing the same terrible outcomes in our students. And I realized like we were doing this to them. And as, curriculum dean, I was responsible for that. And so over the next 5 or 6 years, we embarked on a series of changes for our first and second year medical students that were ultimately incredibly successful in reducing depression and anxiety, while I should say, while maintaining their academic performance. So that inspired me to further my work in 2 directions, actually, towards the GME kind of side, but also looking back at high school students, college students, pre-med students, where, this stress, this problem does not begin in medical school. It begins well before then. So then in 2018, I joined the ACGME and have been focusing mostly on resident and fellow faculty well-being since that time.
That's so incredible and inspiring in and of itself. And I really appreciate in your journey in our earlier conversation, this is also what really stuck out to me, how you are drawing the connection in terms of opening the doors to this conversation that our medical educators, our medical trainees are not coming to us in a vacuum.
No.
They have been high achievers forever.
Yes.
And what's happening to their mental health because of that? I'd love to hear more on that.
Yeah, well, I'll credit to Tom Naska, who just retired as CEO, because when I joined ACGME, I asked for and negotiated 15% time to work on adolescent and young adult mental health, because I made this case that they were coming to us kind of damaged by the system that came before. And I really felt like we should be working upstream on this problem. So yeah, remains a vital interest of my work, is looking kind of earlier in this educational pipeline to see what is it we're doing to kids. And it's now I'm seeing it's earlier than high school that a lot of these kind of threats to mental health are occurring and that we're wiring their brain and developing and nurturing, fostering the development of these problematic mindsets like perfectionism, maladaptive perfectionism.
Absolutely. I'm coming off of this reading the book by Jonathan Haidt, The Anxious Generation. I'm coming off of that. And I can so relate to what you said because we love putting things in black and white categories and like, let's make all these classifications where the way I look at mental health and how we are as humans right now on the planet, we're not in a vacuum and everything leads into the next moment. So as we think of it, when I'm having these conversations, I first like to start by asking you, what does perfectionism mean to you?
Hmm. Yeah. It's an interesting question. And I guess that I've been really very influenced by the research I've done now with high school students, residents, college students, and most recently program coordinators and institutional coordinators in graduate medical education. And in those studies, I've consistently used a couple of scales of survey instruments. One is the Almost Perfect Scale Revised, and I love the name of that. It's like they almost got it right the first time, but then they had to revise it, which I think is just lovely. And then the scale I'm using much more recently, which is the Short Almost Perfect Scale. And the beauty of that one is it's only 8 questions, so you can include it in longer surveys and really look at its relationship to things like depression and anxiety. And these scales, what they're characterized is they define perfectionism as either maladaptive perfectionism or adaptive perfectionism. And they use 2 subscales to define that. The first is high standards. Do you have very high standards? And then the second is what's called discrepancy, that there's a gap between your desired performance and your perceived performance. And what's really interesting about this research is high standards by itself are not associated with particularly negative mental health outcomes. And they're actually huge advantages to having high standards. They push us to achieve and be our best selves and accomplish things. So it turns out that the high standards piece of perfectionism isn't necessarily a bad thing. It's the discrepancy. If you score high on the discrepancy subscale, where again, I describe this as being repeatedly disappointed in your performance, repeatedly disappointed in yourself, that's the toxic element of perfectionism. That's the piece that makes it maladaptive. And if you look then, and you can categorize people as maladaptive perfectionists and adaptive perfectionists, the people who are adaptive, who have low discrepancy scores, actually do very well in terms of mental health and well-being compared to the maladaptive. So understanding those 2 components, I think, is important because I think it's almost easy for us to put perfectionism in a completely negative category. And what I want to make sure that people see is no, it's okay to have high standards for yourself. Keep those, but don't have unrealistic, unachievable standards that lead you to consistently and repeatedly become disappointed in yourself. So that was a long kind of answer. I hope that made sense. And sometimes it's hard when you talk about scales, you can kind of get lost, but hopefully that made sense.
I definitely can see your passion shine through as you talk about it. And the high achiever in me feels relieved that
Yes.
you're giving me permission to have high standards. My question though is, and I love that you point out at the discrepancy and then your findings sounded like the more the discrepancies are there, the more you're noticing this anguish that sort of follows with perfectionism.
Yeah.
How do we kind of determine, well, this is the high standard, and now you're crossing the line here? What's your understanding surrounding that?
Yeah, I think it's really often then really tied to some of the emotions you may feel. And we actually did a study that looked at this, and I know you've talked to Will Bynum as well, that often that these feelings of discrepancy, that you're not measuring up, it can lead to kind of feelings of inadequacy, embarrassment, or shame. And I think those negative feelings are kind of the mediator that leads to then potentially increase in depression and anxiety. And just to say how impressive these associations are, we just published an article on first year undergrad students in a chemistry course, college students in a chemistry course. And we looked at maladaptive perfectionism, depression, and anxiety. And what we found is that R values, correlations between maladaptive perfectionism discrepancy score and anxiety and depression, R values above zero point 0.6, which are just stunningly high, strong correlations that just that single construct, how you view yourself and your performance, can have that strong a correlation when you think of all the other things that can go wrong in a young person's life, I think is just extraordinary. So I think it's such an important kind of psychological construct for us to look at and examine and essentially try to help people with as well.
Absolutely. As you mentioned discrepancy, and as you mentioned this really high rate, would it be sort of safe, and I'm always very careful with putting labels on things, that we can put some sort of almost causation when we're looking at high achievers, or are we still circling the correlation sort of?
And I wish I knew the answer to that. It would be fantastic to try and figure out. My guess is it's circular, right? That when you're a person who has these unrealistically high standards and often disappointed in yourself, that you always have to be in the top 2% of your performance, or you're, feel yourself a failure. I think that has to contribute in some ways to depression and anxiety. But as I'm sure you know, when you're depressed and anxious, your thinking can become more distorted and you can feel worse about yourself. So I think there's a positive feedback loop. So I think it's going to be very difficult to tease those out, but I think both are at play, is my guess.
Both are at play. Okay.
Mhm.
One of the things that I have heard, and I'm thinking back at all the amazing interviews that you have done, and one thing I want to highlight is you have mentioned this pressure cooker scenario almost that happens as we transition from high school to college, to medical school to residency. And then I think about my own journey and I reflect as you're an incredible researcher and leader, and I'm living outside in the clinical domains and have gone through a very personal journey where I felt compelled to hide my burnout, not seek help, hide my postpartum depression, not seek help. And it was all very much tied to perfectionism, acting out this way. I would love for our audience to know more about that journey that we go through in medical education and the implications of that on our mental health.
Yeah, great question. I don't think I've ever really heard anybody connect the idea of kind of stigma and hiding your distress, et cetera, to perfectionism. And I think you're onto something really strong there, because if we have this idealized sense of self that we want to project, it can be, yeah, distressing to show any vulnerability. And maybe it's admitting to some imperfection if we seek help in some way. So I think that's a really interesting kind of thought. I'll talk about, I don't know if this is a mindset. I call these things mindsets, but I don't know if this one is a behavior which is really common in medicine and increasingly in society, that is kind of what you're talking about. And the term that I like, that I use, is Stanford Duck. And Stanford undergrads came from it. And yeah, I use this in my talks a lot. And I think it really connects with people. And basically, Stanford Duck is, if you imagine this duck floating along the water, so peaceful and so calm. But if you look under the surface, their little feet are paddling like crazy. So yeah, we tend to hide our struggles, our challenges. And certainly the culture in medicine encourages that. Look, it doesn't encourage a lot of vulnerability, certainly. And there isn't in medicine, it's this psychological safety that you can show your distress. So it's a big problem that I think we need to continue to try to kind of address and battle in some kind of way by making people feel more safe. It worries me too, because I think there are two problems with it. One is, if everybody's hiding their distress, I think is a problem, is that if you're struggling and you look at all your colleagues and everybody seems like they're doing fine, no, they're probably not. You're probably surrounded by some Stanford ducks. And the second is, if people are really hiding their vulnerability and their difficulties, it just always worried me as an administrator. Like, am I missing the student who desperately needs help, who's profoundly depressed, who may be suicidal, and just is trying to put on that front to hide that struggle? So it's a huge issue, and it's one that we absolutely need to continue to work on in this culture in medicine, is to allow people to be vulnerable so that they can get the kind of help they need and not wait until it's an absolute crisis.
How do you articulate that to the various, like you are in this, I'm jumping a little bit towards a more solution focused conversation, but what you have just shared is so profound. How do you actually go and talk to somebody who is in a hospital system? You talk to a leader. How do you communicate that with your peers? And when I say your peers, I know that across the board, I'm a geriatrician. I never like being ageist, but across the board,
Mhm.
there are more seasoned clinicians that have very strong views in a certain way. And I call myself the bridge builder. I don't like putting labels in places, but there is a certain sense of they have gone through this intense traumatic experience during medical education. And now, as we talk about all these things a bit more openly, thanks to the policies that you're helping create, there's this resistance. Like,
Mhm.
I went through this. You have to go through this as well. So, how do you communicate some of these things?
Ooh, I'm going to struggle with this one. And maybe some of this answer will be a little bit cynical, I hate to say, which is that I'm not sure. Actually, I'm pretty sure we're not going to be able to change everybody into, creating this. And some of it is generational, and there can be an old guard that says people are too soft and you got to be tough and you don't complain and, et cetera, et cetera. I think maybe I'm kind of just free associating here a little bit, but I think I'm less interested in trying to change their minds than making sure that we have enough of a culture that supports that vulnerability, that ability to seek help within every single setting. It's never going to be possible to make it a world. I think we can strive for it, but I think it's going to be impossible where a resident feels like they could go to any faculty member and say, I'm really struggling. So I think it's more for the trainees to make sure that they realize that no, there is in every system, there are people who can support them, who won't judge them, and don't hesitate to kind of seek that out. The difficulty I think we face sometimes, and is that I'm sure as we get depressed, the more depressed we are, it actually, our views of whether you will be judged become worse. So that depression itself causes people to struggle with kind of showing their own vulnerability. So I think what we need to do is make sure that we find faculty and residents who can be those kind of safe people to talk to, and also be forces for continuing to try to shift the culture overall in medicine in this kind of way. One last thing I'll also say, I think this is a really important intervention that I do when I do workshops on these mindsets. I'll describe the mindsets and then have the individuals rate themselves. Like, did this characterize me? Do I struggle with this to a great deal or not at all? And then what's really fascinating, after they fill out these worksheets, I have them turn to the person next to them or in small groups and share. And it's one of the most gratifying things, because oftentimes you'll just see a resident turn to a resident and they'll just like, oh my God, how can you have imposter syndrome? You're the most amazing person I've ever met. And so one of the things that I think can provide some consolation when we work in these mindsets is to help people realize you are not alone with these thought processes. These are endemic. These are completely widespread. And I always say they don't indicate, character weakness or psychopathology, or you didn't choose them. They were fostered and nurtured along this long educational pipeline before they got to med school. So I want people to feel no shame or no embarrassment that they have these kind of distorted thought processes.
What I'm getting from that is not cynicism. I got a lot of realism.
Yeah.
So thank you for sharing that. It also takes away this pressure. And I'm reminded of something I heard Dr. Steph Simmons say in an earlier conversation that I had with her. She leaned into recognizing your circle of control and its circle of influence.
Yeah.
And are we going to be able to change everyone's opinions and thoughts? And I love that you're inviting us to really focus our energy towards where we can add more ground. And hopefully, by creating enough culture change where people do feel that it's okay to ask for help,
Mhm.
the ripple effects will follow
Yeah,
wherever
that's a
they
great
need
way
to
put it.
follow.
Yeah, I like that a lot. That's good.
I'm just curious to also ask you a little bit about from your either your research as you are looking at younger individuals, not just those in medical education, are there any patterns that you might have picked across disciplines that are not just purely physicians, but other high achievers, such as like lawyers, for example, or they're business executives, and there's some commonality as we talk about perfectionism and performance that you might have read, thought, or you can share?
Yeah, I've engaged, of the other professions, I've engaged with law to a degree and have given a number of talks and workshops to kind of legal profession. And absolutely appears to be endemic and widespread there. And I must say, I'm not really familiar with literature as much in other professions. But one of the things that I think is going on is this is becoming kind of ubiquitous because it's being formed so early. And when I talk to high school parents, because I sometimes get to go to schools, high schools, and give talks to parents, one of the things after I give my talks about pressures and maladaptive perfectionism, et cetera, always a parent comes up to me and says, Dr. Slavin, it's like starting much earlier than high school. And I'm hearing from elementary school teachers, from parents, that they have 6 and 7-year-olds who are falling apart if they don't get a perfect score on a quiz. There is something fundamentally different going on. And you talk to the elementary school teachers, they say, yeah, but that is brand new. That is in the last handful of years, and there is something going on here. And what's a little frightening for parents is parents have told me this goes on, and then they say, and we're putting no pressure on our kids. We don't know where this is coming from. So yeah, this stuff is baked into the system early. It's really a consequence of this high pressure kind of academic rigor, and you have to get into the best college possible or your life will be forever compromised kind of culture that is just so toxic for our kids' mental health. And again, I guess what I often tell parents, we're wiring their brains for the future. The maladaptive perfectionism in medical students and resident, it didn't start then. It started well before then. So yeah, that's why, again, why I have such interest in working with younger people on this issue so that hopefully we can kind of start to intervene and actually prevent it from developing in the first place. That would be my ideal goal. Yeah.
I was vigorously shaking my head because when you gave that example of the elementary school children, my daughter, when she was 6, came home with her score. And this is me with all this positivity that I'm trying to create in her life and trying to make her understand that she's enough, that she's whole, that she's, and she comes home and she scored a 99 on her math test. And she goes like, don't even look at that, Mom. I know I was stupid and I did a bad job.
Oh my God.
And it completely crushed me. It completely crushed me. And actually, it reminded me of our earlier conversation in which you said that there's something that's baked into our system that's happening. And I look back at my own life, I just feel that there was a synchronicity of events that happened pretty much at every stage where it was that I have to be perfect. All those 3 components, if we were to break it down, like the other oriented, self-oriented, and socially prescribed perfectionism, it was showing up. And then the relentless, again, I can't ask for help because not only do I have to do the hard thing, I have to look amazing while I'm doing the hard thing.
Yeah. No, I think it's a perfect description. Absolutely. That ties those two concepts together perfectly. I think they're so strongly related. So yeah, absolutely agree.
I know that we got a little very much low in the conversation and as we bring about children but I think it's also very important to have these conversations because so many people, all of us feel that we're in silos, and whether it is in our clinical spaces, whether it is in our roles as parents or other members of the community and the society, what I'm also again and again what's coming up for me as I hear you talk and other experts talk is this is not happening in a vacuum. There's so much more that's happening. It's happening
Absolutely
early.
true. No question.
Where's the hope, Dr. Slavin? What do you see as a community that we can do? What can we do in our organizations? I just want you to zoom out and build some hope for me, please.
Yeah, no, I think what you're doing is one of the most important things we can, which is to shine a light on it. And to me, I think it's so striking that I can give a talk to residents and faculty on these mindsets. And I'll throw in a couple more so you know the other ones I kind of talk about. One that's gotten a lot of attention is imposter phenomenon, which is really important and should. Another one I kind of refer to as performance as identity. It's the experience of getting a test score. And if you're disappointed in it, it's not the feeling that you got that score, but it is, I am that score. Even like your daughter. Like the score means I'm stupid. Very different impact on well-being. And then this kind of concept of toxic comparison, where you only feel good about yourself if you're outperforming others. So there's kind of this whole kind of collection of these mindsets that can be present. And I think one of the things that's most striking about it still is I was just institution on the West Coast giving talks to residents and faculty. And I think it's shocking that many people have never really heard about these, despite thousands of hours of education. And then secondarily, they've never been given any skills to manage these thoughts. I think of all the things we could do for our kids, the most important skill we could give them is the ability to examine their thoughts and recognize when they're inaccurate and manage them in a way that doesn't add to the inevitable distress that occurs in life. So my hope is really kind of resides in the place that none of these mindsets are fixed. Every one of these can be changed and people can learn how to manage it. So I do think we need this kind of a big initiative and the kind of things you're doing, the kinds of things I'm doing to wake people up to this and say, no, we can help people manage these, but ideally we can start to hopefully create cultures that don't reinforce these, that don't nurture these, that don't encourage these in some kind of way. So yeah, I'm always an optimist. I always am.
That was wonderful to hear in terms of just stepping back and allowing ourselves to examine our thoughts. And when we examine our thoughts, it's something that has, again, been a personal, when I'm talking about all these things in my fascination with perfectionism, because not only have I seen myself struggle with it, but so many others, is this severe lacking in self-compassion. And I would love to hear your thoughts as we examine our mindset surrounding things that you've mentioned. And I talk to learners of various degrees, as well as I've had the privilege of having conversations with people such as yourself.
Yeah.
Where can we add more of that? And what are your thoughts on self-compassion, perfectionism? And
Yeah, I think it's critically important. And it's interesting because the way my teaching around this has evolved a little bit, but now I kind of say that I think there are kind of three core skills that you need to have to kind of manage the challenges in life. And so one is metacognition. And within metacognition, I think the most important skill is this cognitive restructuring so that you can recognize these kind of thought patterns and then analyze them and you can actually choose to think differently, right? So that cognitive restructuring is really important. And the like the steps as I describe cognitive restructuring is notice, label, and dispute. And so the noticing step, the first step is just to slow down and notice your thoughts and emotions. That requires some mindful awareness. And I think cultivating mindful awareness in some kind of way, I think is important. The second one is in the labeling, where you give it names. It's like, oh, I'm doing that maladaptive perfectionism, or I'm feeling like an imposter, or I'm using one of those cognitive distortions like magnifying or all or nothing thinking. This is where some of the self-compassion comes in. The last thing you want to do as you're labeling these things is to beat up on yourself and go, oh, I'm such a loser. So you want neutrality at a minimum and hopefully some compassion. And then finally, in the disputing strategy, there are a number of disputing strategies or a different way to think about it. But one of the things I would say is like, and I'm not going to go into detail, with our inner voice, would we talk to anybody else the way we talk to ourselves? If somebody came to you struggling after a delivery with depression, would you have told them, oh, you're a terrible mom. You should be completely embarrassed. You're inadequate, et cetera, et cetera, et cetera. You should be ashamed. I don't know what your inner voice was. No, you would never use that voice, right? With someone else. But why are we comfortable using that with ourselves? So I like self-compassion in action, right? That I think we need to be kind to ourselves and the voices we use with ourselves, And so I think you can embed those in some kind of way in those kind of concrete strategies to manage these narratives so that they aren't cruel, but that they aren't inaccurate, but also that they aren't kind of so negative. Yeah, I think that's how I would put it. Yeah.
That was so beautifully
Mm.
articulated. And I would have loved to hear this so many years ago, but I'm glad I did. I did now.
Yeah. Yeah.
That's exactly what I've been thinking and feeling because we're doing this amazing work surrounding these topics of well being that impact high achievers, that impact us in medicine in specific. But often I felt that when I was struggling, and I was blessed and lucky to be in excellent training programs where my program director actually cared for me. And there was a time in my life that could have been traumatic because of health issues, but it wasn't because she was amazing. Shout out to Dr. Abby Spencer. She's wonderful.
Wonderful.
But I feel that the internal narratives, she was not going to come and sit inside my head and watch my critic criticize me. And so I feel I'm so grateful that we're having these conversations that I can say this out loud to other people as well, that I'm inviting all the clinicians to ask themselves, are you talking to yourself the way you would talk to a peer, a colleague, a loved one?
Yes, I think it's beautiful. And again, I so appreciate your vulnerability and honesty talking about these issues. It's not easy. And I think that that also speaks to something we need to aspire as faculty and educators and clinicians is to recognize those self narratives that the people we're trying to help are probably much darker and more criticizing, more critical than you can imagine, and being open to kind of exploring those gently so that you can say those are inaccurate, And so that I think it's really interesting question that perhaps we should be doing more to inquire of our trainees, our students, et cetera, to say, what are the stories you're telling yourself? Because I'd love to hear them because I think we'd be surprised. I think we'd be surprised often by how critical those narratives are and that we can then help correct them. We can help dispute them, I think, in some kind of way.
I am just visualizing a space where we can all share what that inner critic looks like.
Mhm.
And it's almost like when we share, the inner critic comes out if our mind is present. And then you look around the room, your inner critic is standing right next to you. That would be a very crowded room.
Yes, it is absolutely true. And I think that's a technique which some psychologists I've talked to really like is that when you almost treat these thoughts as a separate person, and sometimes even people will give them a name or a character or something like that so they can see them, so that we kind of distance ourselves and realize this isn't me. This isn't who I am. These are just thoughts that I can manage and control. They don't define me. They don't have to define me. And I think that one of the things that can be such a powerful experience is that sense of gaining some autonomy, control, because it's a very disconcerting feeling to feeling when you've lost control of the narrative, when you've lost control of your emotions, feelings, mood, etc. And so the more we can help people recapture that, the better.
Absolutely.
Mm.
This has been so wonderful.
Mm.
Thank you so much for sharing those incredible insights for the work that you continue to do. Anything else you would like to leave parting words for our listeners, for that medical trainee that's listening to you right now, for the clinician who's struggling listening to you right now, or who's the mom whose daughter wants to become a physician, but she's terrified of what's going to happen to her mental health? What would you say?
Oh my gosh, I could go for an hour with that question. You know what? I'm going to focus in on something, and this, I'd love your input on it as well, really, and I'll try to be quick, which is, reflecting on myself. I think I've been an adaptive perfectionist. I have high standards for myself, but they're not crazy high standards, and I don't beat up on myself if I don't meet them. But I think there's another condition that maybe you and I can talk another time about that I want to put out there and see if you can relate to this, which is not perfectionism or maladaptive perfectionism. It's productivity. I don't know that like I put enormous pressure on myself to be productive. It
Yes.
does, like the product doesn't have to be perfect, okay? But I don't think we really talk about that as much. And, I've been doing some visits to medical centers, and it's understandable, but the pressure that us junior faculty on up put on themselves to not only do the clinical work, but then to be chasing grants and publishing and teaching and getting great evaluations. I think there's this enormous just productivity pressure that I don't know. We'll have to discuss more because I do think it can lead to the same kind of feelings, even if you're not a perfectionist. But does that make sense?
It absolutely
Yeah.
does because it has to be hard and you have to put in the hours. If it's not hard and consistently
Yeah.
piling on, which was my initial defense mechanism when I burned out
Mm.
in the early couple of months after residency when I started working as a primary care physician. And I was actually tested and had one of the highest resiliency scores in my class. And guess who burnt out? I did.
Yeah.
But at that time, productivity served as almost like this defense mechanism. I decided to take on all these other roles to just make me, I guess this is what's going to help me feel better, which is what I tell everyone, like, don't do that, please.
Yeah, that's wild. And the thing then I guess I would end with is if there are trainees who are out there like, oh yeah, or faculty, whoever listening to this, just know you're not alone. I mean, that's the most important thing to say. These are so widespread. And the second thing I would add to that, you certainly go to ACGME, learn at ACGME. There are podcasts, there's a video workshop on how to manage these things if they want to learn more. But really importantly, don't hesitate to get therapy. You don't have to be in crisis to benefit from therapy. And so I've talked to therapists who work with residents, number of them, and they estimate that the average number of visits an individual resident will need to get benefit is like 3 to 4 visits. So you see a therapist, you're not like committing that you're going to be doing it for years, right? So I just think, gosh, don't feel embarrassed. No stigma, no shame in terms of getting help with these things. The world is tough. The environment is tough. And you know this. It's not just work setting that's hard. All sorts of issues in terms of global strife and politics and climate, et cetera. Personal issues, I mean, that can also lead to distress. Don't feel weak. Don't feel bad about yourself if you feel like you need some help. And you see if you're in that position.
On that positive note, thank you so much for your time, your valuable insights, and being with us today, sharing your wisdom. Thank you, Dr. Slavin.
Thank you for having me. Such a pleasure. Always good to see you.
This episode is part of a special series and my budding book project on unmasking perfectionism. Thanks so much for spending time with me today. Just a quick reminder, while I am a physician, I'm not your physician, and nothing in this podcast is medical advice or any kind of professional advice. Everything shared here is based on my personal experiences, and the views expressed are entirely my own. If you enjoyed today's episode, I would love for you to rate, review, subscribe, and share the show with anyone who might need a little inspiration to redefine their own version of success. I'll see you next time. Until then, keep reimagining success one small step at a time.